Hi, welcome to the latest edition of Inside CRCAIH. I'm your host, Melissa Buffalo, and today we are with Dr. Jessica Hanson with the Command Corps. Welcome.
Thank you.
How are you today?
I'm good. Thank you for asking.
Good. So, we again are here to talk about the symposium that is occurring the day before the summit. So, on April 29th from 1 to 5, there'll be a behavioral randomized clinical trial. So, we'll just say RCT for short, symposium. So, again, you want to tell me a little bit about that, and again, just kind of why this symposium is so important.
Sure. I attended a training last summer. It was sponsored by NIH, and it was focused on randomized behavioral clinical trials. And the work that we do is, it's very important to collect a lot of data, right? But we want to take it to that next step and say, okay, we think this intervention works, but does it really work? Especially when we're working with Native American populations. Mm-hmm. And so I think it's an important training because it shows the spectrum of research that as social scientists we can undertake.
Great. Okay. So I like the part about data because we know that's important. Mm-hmm. So you want to kind of expand on maybe the why and the how, and sure. Then the connection to the CRCAIH Summit as we think about sure. Population health.
Yeah, I think the why is because, again, as behavioral scientists, social scientists, we've been trained to collect data, to try out different interventions to see if something works to change behavior. Mm-hmm. We really need to, just like the basic scientists, undergo really rigorous methodology to show that something definitely works, that these significant findings tell us that something does or does not work. And so having a strong methodology like a randomized clinical trial really adds to the literature. It shows us what's significant and what's evidence-based moving forward. Mm-hmm. It really relates to the, it really relates to the CRCAIH Summit, because these types of research methodologies, these types of clinical trials they often exclude American Indian patients and participants. Mm-hmm. And it's really important when we're working with communities not only to think about what is our next step in the research process, but how can this better benefit the tribe that we're working with or the community we're working with. And so with the permission of the communities we work with, we really do want to take our research to the next level and engage our communities in what works for them in terms of collecting data, in terms of randomizing people to a control group. There's different methodologies that a participant or a researcher could undertake that not everyone has to be excluded from research. So really it's about including everyone in the research process.
Awesome. So I will plan to attend, and then just one more question. What do you hope attendees will learn or kind of walk away with?
That's a really good question. What I learned when I attended the NIH training last summer is that there's this huge spectrum of research and they're all important. Mm-hmm. Obviously, a randomized clinical trial is sort of the gold standard of research methodologies, but we know that a pilot study is just as important, or a proof of concept study is just as important, because that informs later clinical trials. Mm-hmm. And so for me, it really helped to highlight how valuable all stages of research are. And I'm hoping that's what people take away from the symposium.
Great. I think it sounds amazing. And again, if you're interested in attending the symposium or the CRCAIH Summit, go ahead and visit our website at www.crcaih.org/summit. And we look forward to seeing you at the symposium and the summit. Thank you.